everyone. I want to do a really quick overview of acid-base. This is something that will come into play a little bit this semester. We're just going to learn the basics about it. This is a topic that you go over in anatomy and physiology. So I'm just going to review that, and then there's a small amount of patho I want you to understand at the end that I talked about in class. But for those of you who weren't there, you'll get this little primer from me. All right, so acid-base balance can be understood first by looking at the components of what is in the body and how that is organized. In the body, this is a male typically, there's about 40 liters of total body water, which is 60% of the body weight. Females have a little bit less body water than males, which does affect absorption of different medications, things of that nature. But again, as I said in class, science doesn't really like to admit that women exist sometimes, so we are going to go over the male body. All right, so 40 liters of water, and that water is separated into a couple of different compartments. It's either in cells, so intracellular fluid, about 25 liters, so physically inside of your cells, so that the cells have some mass associated with them. Or it could be extracellular. That literally means outside of cells. And when we think about outside of cells, that fluid either exists in the interstitium, which is called interstitial fluid, so just the in-between spaces in the body, not in a cell like in an organ, but just floating around. And that's about 12 liters in the body of interstitial fluid. And then the other source, which is in red, is the fluid that's in the plasma. There's about 3 liters of body water in the blood vessels. And what I want you to know about this and think about this going forward is this is our bank. When the body enters states of dehydration, we pull from the plasma very often. What that means is you'll have lower amounts of body water in the plasma. So that's going to alter the blood pressure. So blood pressure starts to drop, you start to feel a little bit dizzy, and then the body engages in water-saving mechanisms, like releasing different products, like antidiuretic hormone, which stops you from peeing out excessive water. So when antidiuretic hormone is around, the urine is really concentrated, it's yellow and dark. All right, so the barriers between intracellular and extracellular fluid is going to be cell walls, right? Cell membranes separate cells from the rest of the body. And the barrier here with extracellular fluid between the plasma and the interstitium is going to be the capillary walls and vessel walls. So those two things are relatively permeable in some cases. But capillaries are definitely very permeable. They have spaces in them and it's easy to get things through them, which is why you'll see a lot of borrowing from the plasma. All right, so looking at what's in the body helps to orient you to why it's important that we rationalize what is in there, what the charges are, and why we have these control mechanisms in place. So we've already talked about water. We have a ton of water in the body. Water is the universal solvent in our individual bodies. Whatever is dissolved in water, we're going to call the solute. So that could be glucose, that could be sodium. We call those solutes. And solutes can be non-electrolytes or electrolytes, which are what plants crave. And when you think about electrolytes, like in sports drinks, like Gatorade, you're looking at things like sodium, potassium. So non-electrolytes, they're most organic compounds and they don't dissociate in water. So those include glucose, lipids, so the fats. Creatinine is a product that is filtered by the kidneys. We talk about this more in the kidney chapter. And urea, which is what makes up urine, uric acid. So these do not involve charged particles. Where electrolytes, these are charged particles. So they dissociate into water, so that means you can dissolve them in water. And inorganic salts, acids and bases, some proteins, These things have a charge with them, which means they generate a current, and cells have to have some sort of control mechanism to keep the amount of acids and bases and positive and negative on one side of the membrane versus the other. There is a rule in biochemistry. If you don't know it, you should know it by now. Today's the day. And it's a saying, and it is where sodium goes, water follows. When something has the power to shift water, when it can physically move water, and water likes to dilute things, water dilutes. So water moves to places where it is in low concentration. So there'd be a high solute concentration there. So water will move over a barrier to shift fluid to dissolve or to dilute a very hypertonic environment. When something can shift fluid, we call it an osmol, meaning it has osmotic power. It has the power to physically cause the movement of water. And osmosis is the diffusion of water over a membrane. So when you say learning by osmosis, that's not true technically because it's not the movement of water. We would say learning by diffusion to make that an accurate statement. So the things that we keep in mind as most important to keep control of are sodium, potassium, and chloride. The other things on here are kind of important, but not right now. We will talk about bicarbonate. But what I want you to know, if you don't know already, is that sodium and chloride are really high outside of cells. Think about the interstitium of your body like the ocean. They're high in sodium and chloride. So sodium's high in the blood and in the interstitium, chloride's high in the blood and in the interstitium. Chloride follows sodium like a tail follows a dog. It doesn't have a choice. They have this opposite charge. They move together and they're going to travel together. Whereas potassium, this is a positively charged ion and it usually moves by itself. Potassium's really low in those spaces, which means it's really high inside of cells. So when you think about which ion is high inside of cells, it is potassium. Also remember that things like to move down their concentration gradient. So if there's an open door into a cell and we're not controlling this movement of a charged particle, sodium and chloride will naturally go into the cell, whereas potassium would naturally leave the cell, because things like to go from high to low concentration. So this happens all the time. It's just fluid movement, and it happens between those compartments of intracellular, extracellular fluid. They're always mixing. The body tries to keep osmolality pretty much equal, and then what shifts then is going to be the water when there is a change to the tonicity of that environment, if there's a lot of solute or not a lot of solute. So these are the things that we've mentioned. Here's your blood and interstitial fluid. These would be separated by the capillary membrane. Here's some cells housing intracellular fluid. This up here is all extracellular. So we see the exchange of gases we've already talked about, like oxygen and carbon dioxide. When you eat food, there's a diffusion of nutrients from the GI tract, and those go into these compartments of water, of ions, of waste products. So these things are shifting back and forth. And remember that the solutes, they go from high to low concentration. That's called simple passive diffusion, moving from high to low concentration. What moves in a different way is water. Water moves to high solute concentration environments. All right, when we're looking at how water is maintained throughout the day so that we don't go into our plasma bank, the average source of water intake, there's metabolic processes that create water, there's foods that serve as a water source, and most of the time it's drinking things. Beverages account for a large amount of water intake. We have a thirst mechanism to drive this process so that we hopefully don't get into states of dehydration. And then a typical amount of water lost per day that we have to make up through things like drinking and eating, about 100 mils through the feces, 200 mils through the sweat. Insensible loss via skin and lungs means just dehydration, like things evaporate into the air. And then we have urine. And I want you to notice that whatever you drink is matched by the urine. Water in equals water out, which means people need to be drinking something throughout the day. And you've probably heard the saying that if you're thirsty, you're already dehydrated. And that's true. I heard somebody on the radio the other day saying it wasn't true, and I got really mad because that is, oh no, I messed it up. Let's just give up, okay? When things get tough, just give up. Remember that. So I want you to pay attention to this top here. This is our thirst mechanism. So there's a couple of messages that would tell your body that you're thirsty, that it's time to drink. The first one is going to be lowered plasma volume. So we're taking from the bank of the water in our vessels. That water exerts a pressure on the vessel walls in the same way that your pants that you're wearing right now, your legs and your bottom and anything else that's in the pants, your legs are exerting a pressure on the pants, right? So if we borrowed some of your legs, so let's say you lost 20 pounds, there's going to be less pressure of your legs on your pants. So that's the same way that blood pressure works. When there's less stuff in the vessel, there's less pressure. When there's a dip in blood pressure, there are cells in the kidney, they're called JG cells, and they make a product called renin. And we'll learn about this in the blood pressure chapter. But renin activates this cascade called the renin-angiotensin-aldosterone mechanism. And the endpoint of that mechanism is the creation of this substance called angiotensin II. And whenever angiotensin II is around, the blood pressure will go up. It changes the tension of the vessels, it turns on the sympathetic nervous system, and it helps to restore the blood pressure so that you don't die or go into shock. So that's one thing. We've got just lowered pressure turning on this angiotensin II system. The other thing that the body notices is when there's an increase of extracellular fluid osmolality, meaning there's more solute in the extracellular fluid than there is water. There's cells in your brain in the hypothalamic areas, which is our homeostatic center, the hypothalamus. They're called osmoreceptors. And osmo refers to water. So these are cells that physically are there to sense changes in osmolality. And as we'll see on the next slide, you have physical changes to the size and shape of cells when there's a high tonicity versus low tonicity environment because of the way that water moves. So those cells in the brain, they change shape, which signals to your thirst center that you probably are thirsty and you need to take a drink. The other thing you'll notice is a physical sign, but also very indicative that dehydration is starting to occur, and that's a decreased amount of saliva. And when your saliva production goes down, the mouth gets dry, it becomes more difficult to speak, and it becomes a little uncomfortable. So when there is a dry mouth, because saliva is made up of a lot of water, we're saying that there's not enough water to constitute the creation of that saliva, so then the mouth gets dry. So the osmoreceptors changing shape, this decreased production of saliva in the dry mouth, those also will signal to the thirst center of the hypothalamus that you're thirsty and you need to take a drink. So you take a drink, the water goes down your mouth, hopefully, your throat, stretches your stomach, your intestines, and that will signal to the hypothalamic thirst center, like, listen, they're listening, hooray, they're drinking something, we're not going to die. When you're thirsty, it still takes time for that water to go through the GI tract and be absorbed in the small intestine. So it's still going to take at least an hour for this extracellular volume to be replenished. So that's why we say when you're thirsty, you're already dehydrated. You've already changed the size and the shape of the cells, these osmoreceptors in your brain. So when people are continuously staying hydrated throughout the day, there isn't going to be a really strong thirst signal. But that occurs to lower the osmolality and increase the plasma volume. So blood pressure goes up and the tonicity of the environment is going to decrease. So looking at this next slide, so this is what physically is going to happen to those osmoreceptors. So first off, we have an isotonic solution, meaning everything like water and solute are balanced. And in isotonic solutions, water isn't attracted to an area of high tonicity. It can stay where it is, which means that cells, like here's a red blood cell, they have normal size and shape and they appear as they should. In hypertonic solutions, so there's too much tonicity, there's too much sodium, too much chloride, too much everything out here. Water, as we know, is in cells, and we also know that water moves to where there's a high solute. It wants to go diluted. So in hypertonic environments, like in dehydrated states, the water will leave the cell like, I need to help, and it physically moves outside of the cell, and that means the cell's going to change size. It's going to get smaller. In your brain, this is really important for the thirst signal. So you're going to see a shape change with osmoreceptors. When there are hypotonic solutions, meaning there's low tonicity here and normal tonicity inside of a cell, again, what you'll see is the water will move to a high solute concentration. And if there's higher solute inside of cells, the water will be attracted there. This is really dangerous because that causes the cells to swell, and in some cases they can burst. When this happens in your brain, like there's something called water intoxication, where people overhydrate in some cases, the brain cells physically swell, and there's nowhere for brain cells to go, so that can lead to not only feeling like you have a headache, but feeling really tired. It can lead to seizures, coma, and then death. It's really dangerous. So don't take this lightly. It's really important that we maintain our solute concentration and not throw it too far off. Okay, so here are consequences of dehydration written out for you, as we've talked about. When there's an excessive loss of water from the extracellular fluid, the pressure that drives water, the osmotic pressure, goes up, and then cells lose water to the extracellular fluid by osmosis, and the cells shrink. So this is a hypertonic environment, dehydration, and the cells are going to give up their water because water wants to go dilute this hypertonic environment. Here's hypotonic, so in cases like water intoxication, there's too much water out here relative to solute. So the water builds up in the extracellular fluid. There's not a good osmotic pressure that keeps water where it is. So then water moves into cells, the cells swell, and then they can burst. So that's the dangerous one. We don't want that to happen. We want to maintain hydration. That's why doing things like fluid administration in the hospital is so important. That's why you'll do things like add dressings to burn wounds so that we don't lose via dehydration or evaporation the body water. Okay, final things. I promise this is easy. We need to know perfect pH, and all of those different ions out in the extracellular fluid and inside of cells. Those go together to determine what the pH is in the body. It's called the Henderson-Hasselbalch equation. And what that leads to is a pH in the normal bodily fluids of about 7.4. And if you look at just air levels, you'll see normal should be about 7.35 to 7.45. This is very tightly controlled. When we get to anything above 7.45, that means there's not enough acid. There's too much base. There's too much of a basic type of solution and a higher pH. That's called alkalosis. It's too alkaline of an environment. If the pH goes below 7.35, that's called acidosis, when the pH falls, because there's more acid relative to bases. You start to see physical symptoms in patients when you're between these levels of 7.65, 6.85, and then there's physical death when you get to these levels around 8 or 6.8. So it's really important that we know what these things are. Physically, biochemical reactions don't occur when you get off of this perfect pH. So, as we mentioned in class, the minute-by-minute controller of this pH is the respiratory system. So just first off, I want you to know it doesn't matter what caused this acid-base imbalance, the kidneys and the lungs are going to work together to try to restore it. The kidneys can only do so much, and they usually only kick in after a couple of days of respiratory non-compliance. The respiratory system is minute-by-minute alterations using exchange of CO2 as an acid to try to restore the pH. And the lungs are really good at changing the respiratory rate and depth to maintain pH so that the host body that they live in doesn't die. So the kidneys will help, but the respiratory system is going to be the immediate one. They'll both help out regardless of who caused this issue. All right, so when there are changes to the pH, there's respiratory compensation, meaning the body will change the respiratory rate and the depth of breathing. It'll change the tidal volume. When there's metabolic acidosis, and here's a little trick, whatever word comes before acidosis or alkalosis is what caused it. So it's either going to be respiratory acidosis or metabolic. Metabolic means something besides the lungs. So there's only two types. There's respiratory and metabolic. When there's metabolic acidosis, that hydrogen ion we mentioned in class, which dissociates as part of breaking down CO2, that hydrogen ion stimulates the respiratory centers in the brain to stimulate ventilation. The rate and depth of breathing goes up. So tidal volume goes up and respiratory rate goes up. Blood pH is below 7.35 and bicarbonate is low. When you start to eliminate CO2 by the respiratory system, remember CO2 is an acid. So the more CO2 you lose, the higher the pH will go. So the body will attempt to exhale as much CO2 to restore the pH of the body. In alkalosis, where the pH is too high, the body needs to bring in CO2 to lower the pH again. So in that case, there's slow, shallow breathing so that CO2 can accumulate in the blood. So if you usually breathe like 12 times a minute, the body will decrease that. More time in between respirations or ventilations to allow CO2 to accumulate. I hope that makes sense. So we either want more CO2 or less CO2. And if you remember, CO2 is an acid. Please remember that. That will help you answer any questions about it. What can the kidneys do? Well, not a ton. The only thing that they can really do is excrete whatever is extra. And we talk about this more in the kidney chapter, but I promise you it makes sense. So let's look at this picture of a nephron. There is a part of the nephron called the collecting ducts. That's what I'm showing you here, the proximal collecting duct. So the collecting ducts, that's a place where you can secrete things that are excessive in the blood. So if somebody is in a state of acidosis, that means they have too much hydrogen ion accumulating in the body. The only thing the kidneys can do is try to pee out the extra hydrogen ion. So when people have acidosis types of states, you'll see that their urine is acidic because we can get rid of the extra hydrogen. When people have a really high pH state, so they have alkalosis, we can secrete the extra bicarbonate, the extra base into that duct, so that when you're looking at the urine, it is a high pH. So you can determine what state the body's in by looking at the pH of the urine, because the kidneys can excrete whatever is extra. That's a nice little trick that they can do. So they'll work together with the lungs to try to restore the body's pH. What we say in real time is it takes about 3 days for the kidneys to get involved. The lungs are going to be the immediate ones that address the issue. And that's acid base. It's not so bad, right? So acidosis would be evident at which blood pH? 7.6, 7.5, 7.4, 7.3. We know that 7.4 is our perfect pH, so it can't be that. 7.5 and 7.6 are higher than 7.4, and acids have low pH, so those wouldn't be correct. 7.3 is below 7.4, so that's our low pH, and that is indicative of an acidotic state. So now think about what the respiratory compensation would have to be in acidosis. All right, good job, everyone. Go team.